Your gallbladder is a small organ. It sits just beneath your liver, on the right side of your abdomen. Think of it as a little storage pouch. Its main job is to store bile, a digestive fluid made by your liver. Bile helps your body break down fatty foods. When you eat, especially foods with fat, your gallbladder releases this bile into your small intestine. This process is usually smooth and unnoticeable. Most people don't even think about their gallbladder until something goes wrong. It's a helpful part of your digestive system, working quietly behind the scenes every day to aid in digestion. So, what is a laparoscopic cholecystectomy? Let's break that down. Cholecystectomy is the medical term for removing the gallbladder. The laparoscopic part refers to how the surgery is done. Instead of one large cut, surgeons use a method often called keyhole surgery. This means they make a few very small incisions, usually less than an inch long. Through these tiny openings, they insert special tools and a small camera. This camera, called a laparoscope, sends images to a video monitor in the operating room. This allows the surgeon to see inside your body clearly without making a large incision, which is a major advancement. This technique is truly a game changer in gallbladder surgery. Before laparoscopic surgery became common, removing a gallbladder meant a large abdominal incision. This older method, called an open cholecystectomy, involved a longer hospital stay. Patients also experienced more pain after the surgery. Recovery time was much slower, often taking many weeks. The introduction of the laparoscopic approach significantly reduced these challenges. It has made gallbladder removal a much less invasive procedure. Patients can now recover faster and with less discomfort than ever before, which is a fantastic development for those needing this operation. Why would someone need to have their gallbladder removed? The most common reason is gallstones. These are small, hard deposits that can form inside the gallbladder. Sometimes these stones don't cause any problems. However, they can also block the flow of bile. This blockage can lead to inflammation, infection, and significant pain, especially after eating fatty meals. When these symptoms become frequent or severe, your doctor might recommend removing the gallbladder. This surgery aims to relieve the pain and prevent further complications caused by these problematic gallstones or other gallbladder diseases. The decision to undergo a laparoscopic cholecystectomy usually comes after experiencing uncomfortable symptoms. Gallstones are the primary culprits. These stones can be as small as a grain of sand or as large as a golf ball. When they obstruct the bile ducts, intense pain can occur in the upper right abdomen. This pain might radiate to your back or shoulder. Nausea and vomiting are also common companions to this pain. Sometimes, the gallbladder itself can become inflamed, a condition called cholecystitis. This inflammation can cause persistent pain and fever, signaling that the organ is in distress and may need to be removed for relief. The symptoms prompting this surgery often follow a pattern. Many people notice pain, particularly after eating a meal rich in fats. This pain can be sudden and escalate quickly. It might last for a few minutes or several hours. Other signs can include bloating, indigestion, and a general feeling of discomfort in the abdomen. If gallstones pass into the common bile duct, they can cause jaundice, which is a yellowing of the skin and eyes, or pancreatitis. These more serious complications make the removal of the gallbladder even more critical to prevent further health issues and restore well-being. So, how exactly does the surgeon perform this keyhole operation? First, you will be given general anesthesia, so you will be completely asleep and feel no pain during the procedure. The surgeon then makes a few small incisions in your abdomen. Usually there are 3 or 4 of these tiny cuts. One incision, often near the belly button, is used to insert the laparoscope. This thin tube has a light and a camera on its tip. The camera projects a magnified view of your internal organs onto a high-definition monitor, giving the surgeon a clear view. Through the other small incisions, the surgeon inserts specialized surgical instruments. To get a better view and more room to work, your abdomen is gently inflated with carbon dioxide gas. This gas lifts the abdominal wall away from the organs below. Using the video monitor as a guide, the surgeon carefully identifies the gallbladder. They will then meticulously dissect it, which means detaching it from the liver and other surrounding structures. The bile duct and blood vessels connected to the gallbladder are clipped and cut. Once the gallbladder is free, it is carefully removed through one of the small incisions. Finally, the gas is released, and the small incisions are closed with stitches or surgical tape. Getting ready for your laparoscopic cholecystectomy involves a few important steps. Your doctor will provide specific instructions which you should follow carefully. Typically, you will be asked not to eat or drink anything for several hours before the surgery, usually starting from midnight the night before. This is a standard precaution for any procedure involving general anesthesia. You might also need to undergo some pre-operative tests, such as blood tests or an ultrasound, to ensure you are fit for surgery. It's also crucial to inform your doctor about any medications you are taking, including over-the-counter drugs and supplements. Immediately after the surgery, you will be taken to a recovery area. Here, nurses will monitor your vital signs, such as your heart rate and breathing, as you wake up from the anesthesia. You might feel some grogginess or nausea, which is common after anesthesia, but medication can help manage these feelings. You will likely experience some pain or discomfort in your abdomen, particularly around the incision sites. Pain medication will be provided to keep you comfortable. Many patients are surprised at how quickly they start to feel alert, though taking it easy is very important during this initial phase. Most people are able to go home on the same day as their laparoscopic cholecystectomy, or sometimes the next morning. This quick turnaround is one of the major benefits of this minimally invasive procedure. Before you leave, your medical team will give you instructions for care at home. This will include how to look after your incision sites, signs of potential complications to watch out for, and any dietary recommendations. You might be advised to start with clear liquids and gradually reintroduce solid foods. It's normal to feel some soreness or bloating for a few days. The road to full recovery is usually quite swift. You'll be encouraged to walk around as soon as you feel able, as light activity can help with healing and prevent blood clots. However, you should avoid strenuous activities and heavy lifting for a few weeks, as advised by your surgeon. Most people can return to work and normal daily routines within 1 to 2 weeks, depending on the nature of their job and how they are feeling. The small scars from the incisions will fade over time. The most important thing is to listen to your body and rest when you need to during this healing period. Like any surgical procedure, laparoscopic cholecystectomy does carry some potential risks, though they are generally uncommon. It is important to be aware of them. These can include risks associated with general anesthesia, such as an allergic reaction or breathing problems, but these are rare. Specific to the surgery itself, there is a small chance of infection at the incision sites or bleeding inside the abdomen. Another potential, though infrequent complication, is injury to the bile ducts, bowel, or blood vessels near the gallbladder. Surgeons are highly trained to minimize these risks and take every precaution. It's reassuring to know that serious complications are not common, and your surgical team is well prepared to manage any issues that might arise. Sometimes a small amount of bile can leak into the abdomen after the gallbladder is removed. This might require further treatment, but it is also a rare occurrence. In very few cases, if there are unexpected difficulties during the laparoscopic procedure, the surgeon might need to switch to an open cholecystectomy with a larger incision. This decision is always made with your safety as the top priority. Open communication with your doctor before surgery will help address any concerns you may have. The overwhelming majority of people who undergo a laparoscopic cholecystectomy experience significant relief from their symptoms. The pain and discomfort caused by gallstones or an inflamed gallbladder typically disappear once the organ is removed. This means you can often go back to enjoying meals without the fear of triggering an attack of pain. Digestion generally returns to normal for most individuals. Your liver will continue to produce bile, which will now flow directly into your small intestine instead of being stored in the gallbladder first. This change is usually well tolerated by the body. In conclusion, laparoscopic cholecystectomy is a highly effective and common procedure that has truly changed the game for treating gallbladder problems. It offers a much quicker recovery, less pain, and smaller scars compared to older surgical methods. While there are potential risks, as with any surgery, they are generally low. For most patients, the outcome is a significant improvement in their quality of life. Freedom from gallbladder pain allows people to return to their daily activities and enjoy life more fully. It's a testament to how medical advancements continue to make a positive impact on patient care and well-being.